Hello and welcome to a brief overview of the Obama budget proposal for fiscal year 2015. My name is John Collins. I'm the managing director of GL Advisor, and I'll be sharing key components of this proposal that relate to student loan repayment and its potential impact on medical students and residents. Every year, the President publishes a budget proposal for the upcoming fiscal year. In recent years, the proposals are often partisan and never are approved and implemented as proposed. For fiscal year 2015, which starts on October 1st of this year, the administration proposed significant investments in infrastructure, for example, the overhaul of our bridge system, as well as research to fight and cure different diseases. Tax cuts include an increase in the Earned Income Tax Credit, while education reform could potentially impact toddlers to graduate students. Higher education reform changes touch on Pell Grants, potentially new grant programs, and an extension of the American Opportunity Tax Credit past its current 2017 expiration. The focus on higher education and specifically loan repayment is nothing new. Obama has always worked to appeal to younger generations, recognizing their potential as a very critical voting demographic and their plight as one that must be addressed. An example of this would be his announcement of the PAYE, or Pay As You Earn program, in October of 2011, which led to its eventual implementation in July of 2012. As seen here below, Pay As You Earn is an improvement over the previously existent IBR, or Income-Based Repayment program, capping monthly payments at 10% instead of 15% of discretionary income, and allowing for the forgiveness of the remaining federal student loan debt balance after 20 years of payments instead of 25. However, Pay As You Earn is only available to a small subset of borrowers, those who had no outstanding federal student loan debt balance on October 1st, 2007, and also had a disbursement of additional federal student loan funds after October 1st, 2011. Currently, all borrowers with a partial financial hardship are eligible for IBR. Important to note as well, both programs cap your monthly payment at the initial 10-year standard amount you would have been charged when you first began repayment had you selected that repayment option. Public Service Loan Forgiveness is a completely separate program. However, it works in concert with both of the aforementioned repayment plans, relieving public or nonprofit sector workers of their remaining federal student loan debt balance after 10 years and 120 qualified payments while employed in that sector. For many young medical professionals, this program is critical, provides much needed relief, especially as the salaries of certain primary care physicians, internists, and others who are often employed by these nonprofit entities stagnate under pressure from insurers. Under the 2015 budget proposal from the administration, all borrowers would be able to limit their monthly payments to 10% of their discretionary income, just as pay-as-you-earn eligible borrowers may do today. This by itself is welcome news, as even smaller initial payments allow residents to more easily manage their cash flow at the start of their career. Additionally, this should decrease confusion often experienced by servicers, as they attempt to determine who is and who is not eligible for pay-as-you-earn. However, the cap on payments would be removed, suggesting that borrowers who eventually earn higher incomes may be required to pay significantly more than the normal standard 10-year payment plan would necessitate. Of equal importance are the proposed changes to the Public Service Loan Forgiveness Program, framed as a requirement aimed to, quote, protect against institutional practices that may further increase student indebtedness. Obama proposes to limit the amount forgiven through the PSLF program to $57,500. Now, this number is derived from the federal student loan borrowing limit for an independent undergraduate, and it's of course well below the $160,000 to $220,000 that the average medical student graduating in 2014 has, not to mention future medical school graduates. With relatively inelastic demand for medical school education, this change would likely have no impact on tuition rates at university programs across the U.S. In addition to these changes to PSLF, all borrowers, regardless of their employment, would be eligible now to have balances of up to $57,500 forgiven by the federal government after 20 years of qualified payments. Balances in excess of this figure would remain an obligation of the borrower until paid in full or until 25 total years of repayment. While the $57,500 limit to the forgiveness value at 20 years is not necessarily advantageous to certain borrowers, the proposal also allows balances forgiven at 20 years and or 25 years to avoid tax consideration, whereas existing legislation considers the forgiveness amounts as taxable income. To examine how this may impact a 2014 medical school graduate, we've prepared a very simple analysis. Let's start with the average debt portfolio for a graduate this year. With just under $200,000 at around 7% interest, our graduate's education debt is certainly a sizable concern that must be addressed strategically. Given the terms of pay-as-you-earn and public service loan forgiveness, our borrower strides into residency very confident that she can effectively manage her debt in an affordable, cost-effective fashion. Utilizing today's programs, our newly minted MD or DO can do just that. If she does her residency, let's assume it's a 4-year program, and also does her 6 years as an attending in nonprofit 501c3 hospitals while repaying her debt utilizing the pay-as-you-earn program, she'll be eligible for forgiveness of her entire balance at the end of 10 years. Now, what does that look like? Well, during this 10-year period, her highest monthly payment will be less than $1,400. The balance remaining at the time her loan balance is forgiven will be around $230,000, and she'll spend just under $97,000 total. Now, we've assumed that she's in one of the primary care specialties and that during her time as an attending, her average residency salary was around $170,000 annually. Now, on the other hand, let's assume that the proposal recently laid out is approved and is forced upon the thousands of students and borrowers who've already developed a reliance on the current program details. The economics look very, very different. Our doctor's average monthly payment would increase by an average of $400 per month, and she wouldn't be done paying her debt for an additional 10 years, spending nearly $200,000 more to retire her debt balance. Now, how does this impact you? For attendings or those of you participating in a residency or fellowship, or even on the precipice of graduating from medical school this spring, you should be reassured by a few things. For one, the Master Promissory Notes or MPNs you signed in order to borrow each loan you took out for medical school included language about public service loan forgiveness and your right to utilize the program. Thus, a legal contract between you and the federal government says you borrowed under the assumption you'd be able to utilize the PSLF program just as it is stated today, just as the details state today specifically. Secondly, if you're actively working towards repaying your loans through the Public Service Loan Forgiveness Program, and you've made some economic decisions based on these program details, you've demonstrated what we call a detrimental reliance on the terms as they exist today. And as such, the federal government is obligated to grandfather you and others in the same situation through any changes to the law based on historical legal precedent. In summary, this means you're very unlikely to be affected by these proposed changes, even if they are passed. However, what if you're an M1, an M2, an M3, or even a future medical student? Well, you can also take comfort in similar facts, including your existing loans require you to sign MPNs or Master Promissory Notes that include the mention of PSLF as well. Additionally, and maybe even more importantly, the unintended impact the proposed changes to the PSLF program would have on the supply of healthcare would most likely harm the success of the Affordable Care Act, also known as Obamacare or the ACA. Many students and young health professionals see and even saw previously public service loan forgiveness as a means to make their career serving others possible, especially in light of the lack of growth in primary care physician wages over the past decades. Recognizing these facts, GL and many other institutions are advocating on behalf of graduate students and professionals in hopes that the detrimental changes to PSLF and the repayment programs are not passed into law. So you should stay informed. You can utilize your financial aid officers, leverage your GME leaders, or other House staff administrators to keep you informed of these changes that are going on, to keep you informed of the legislative process around this budget proposal. Additionally, major news networks have and most likely will continue to publish a modest volume of news related to the student loan industry and the plight of today's graduate and undergraduate students. GL specifically works to stay on top of all of the relevant news for our clients and those who rely on us for advice. Our Facebook and Twitter posts will include daily updates and opinions on these events. Additionally, clients who work with us may consult with their own advisor about the changes and what the company is doing to protect its stakeholders and customers. I want to thank you for your time, and I really hope you found this session informative. One of our analysts here at GL Advisor would be happy to discuss your questions or concerns over the phone at your convenience. So feel free to register for a complimentary consultation. You can visit gladvisor.com or glplan.com, or just call us at 877 552 9907. Also, as I mentioned before, a great way to stay on top of the latest student loan and financial planning news is to follow us on Facebook and Twitter. And as these updates change, we will be posting sessions similar to this, so stay tuned.